Okay, so the next picture I've got here for you is a screenshot, and it's a screenshot of what the Allscripts My Way product looks like in what we call Full Note Composer. This is your patient's medical chart. So you'll see here, this is the front of the chart for this particular visit, where the nurse is going to come in and do the height and weight and blood pressure, heart rate, and so forth. But you see, this isn't your typical vitals page. You're going to note here that we've got a calculation that we can do in metric values as well, so you can do that either way. We can even do as minimal as ounces, so your weight can be very precise. We can say whether you were clothed or undressed. You know, we can really get precise on the weight and the height. We also calculate BMI on here, so body mass index. That is something that you'll want to see as one of your meaningful use measures. We have head circumference on here for pediatric practices, and then you'll notice how specific the rest of your vitals are: sitting, standing, lying down, right arm, left arm, you know, O2, saturation. All of this on here is very important, and it can be based on specialty and diagnosis as well, but the ability to do this and the fact that you're utilizing this will also help you provide a demonstration of meaningful use of your system. This is a page that is in Full Note Composer as well. It's the history page, so it's very important that we take a full medical history on our patients, that we go through their medical, their surgical, their family, their social, putting down things like, do you wear a seatbelt, and do you use tobacco and alcohol and illicit drugs, and you know, so on and so forth. These are all measures that can be recorded for meaningful use, and so the software makes it very easy to do that, and any certified software that you utilize should provide that in a very easy, user-friendly way for you so that you can meet those measures. Over to the next slide, and you'll see a drug screening. Now, this is one of my favorite meaningful use measures because it is so important to a patient to know that their doctor is being alerted as they're prescribing. So maybe the doctor forgot that I take a particular medication as he's choosing something to treat what I have today. He'll get a screen that pops up that says, you know, this could be a problem with this other medication she's on. This is a conflicting drug. So we definitely want to have the information in front of the doctors. You'll have options that the doctor can choose from. They can choose to bypass it and go on forward, or they can go back and change it to another medication. But this is a meaningful use measure, so you definitely want to keep that in mind, because that's also a very helpful thing that we're doing with this new EHR. Next slide shows what we call the one-page summary in our Allscripts program. And this is basically the patient comes in and says, I need a copy of my medical records. Great. So you can just print this up, and if you were able to scroll down on the actual software program here, you could see that it goes visit by visit by visit and talks about what they were in for and how they were cared for, lab results, history of medication. All of these things are going to be on this summary, so you could print this out for your patient, or you could also send this information electronically to another provider, given that they were compliant and able to receive it, which by 2015 most everyone will be. So it's a very nice option to have. And you can also offer this to your patients at the end of their visit, which is part of meaningful use, to be able to say, would you like a copy of today's visit for your own personal health record? This cuts down on a lot of cost if you can have your patients maintaining their own health records. They're not coming back into you saying, hey, I need copies of all this, and then you're spending time. Even printing it out or sending it electronically is super easy, but if they're maintaining it as they go, that's just one less thing that they may be concerned with down the road. So you're giving their health care into their hands, which is very important to the measures that we're talking about today.